So a patient asks you, the sedation anesthesia that you do in the office, is it safe? I've heard some horror stories about it, but is it safe for me to undergo? Well, the answer that I would give is that it's very safe. It's actually in some ways safer than just doing it under local anesthesia, because when you're getting the injections, especially for an anxious patient, their blood pressure, their heart rate are all going to rise really, really high. And so if we can start a little IV in your arm, give you a little medication, you go off into a little twilight sleep, you're going to be much more calm and relaxed while we're doing the procedure that we need to do. You can tell them, Dr. Chaudhry has done tens of thousands of sedation cases in the office, and he's never really had any major complications. So you're very safe. Now, the other thing to mention is that we put in all the monitors that you would pretty much have in an operating room here right in our office. So we're going to be measuring your oxygen level, your blood pressure. We're going to be looking at your heart rate. We're going to have EKG monitors for you. And we're going to be giving you supplemental oxygen throughout the procedure as well. And you're going to be monitored constantly throughout the procedure. So it's something which is very safe. However, if Dr. Chaudhry feels like you might have a medical condition or some other medical issues that would warrant you being taken to the hospital, we can do that as well. But for most patients who are generally in good health, they can have sedation or anesthesia right in the office. Now, how do you explain what exactly is sedation? Well, twilight sleep is something which most patients kind of understand, but you can tell them it's the same type of thing you would get if you had a colonoscopy done or a minor surgical procedure in the office. We don't stop your breathing, you don't get a breathing tube down your throat. It's basically some light sedation to calm you, and during the procedure, if we need you to do something like open your mouth really big or take a deep breath, you'll be able to do that. But then you'll kind of fall back and drift back into sleep right after that. So it's a very safe procedure, and it really makes patients, especially who are anxious, very calm during the neurosurgical procedure.